Hi, Mr. Ward. I'm
Hi.
Michelle.
Dustin, nice to meet you.
Nice to meet you. I am an adult gerontology nurse practitioner in the primary care setting.
Okay.
Are you familiar with the role of the nurse practitioner?
Not really.
Okay. So what nurse practitioners do, or primary care nurse practitioners do, is I treat any adults over the age of 13 into older adulthood in the outpatient setting, and what I can manage disease, diagnose, prescribe medications, or provide referrals when necessary.
Okay.
Okay. Can you tell me your full name and date of birth?
Sure. Dustin Terrence Ward. Birth date is April 14, 1986.
Okay. Do you mind if I call you Dustin?
Go for it.
Okay. So, tell me, what are you here for?
I basically just need a new doctor. So I used to live in the suburbs, and it's just a pain to get out there now that I live in the city. So I need a new doctor.
So you're trying to establish primary care?
Mm-hmm.
When was the last time you've been for a physical exam?
Probably like 10 years ago, maybe. Right
10 years
before
ago.
college, I would imagine.
Okay, and during that physical exam, did they find anything? Any problems or?
Nope.
Okay. And since, in those 10 years, have you seen a specialist or have you gone to the emergency department for anything or any hospitalizations?
The only thing I've had is I had a couple of surgeries on my knee.
Okay.
Tore my ACL a couple times, so went to a specialist for that.
Okay.
And I guess I've been to a dermatologist.
Okay. When was your last visit to the dermatologist?
I actually went like a month ago.
Okay.
Um,
What did you go there for?
I went there originally to get my moles looked at.
Okay.
And I had some prescriptions that I wanted refilled.
Okay. And did they find anything? Any
Nope.
problems or?
Nope,
Okay.
moles look good.
Okay, that's good. And then what prescriptions were you getting filled?
Prescription for Propecia,
Okay.
and one for something for my foot. I had like a fungus going on there.
Okay. Do you still have it?
The
The
what?
fungus in your
foot? Yeah, but it's going away. The medicine's helping.
Okay, that's good. So let's kind of just get into your medical history.
Okay.
Do you have any major health problems?
No.
No. Okay. Any childhood
Uh,
major illnesses or problems?
so childhood, I definitely had bad allergies and
Okay.
asthma. So the allergies would often trigger like asthma attacks and stuff like that. But I haven't really had any symptoms for that since like middle school.
Middle
It
school.
seems to have gone away, and I don't really have any issues now.
Okay. When were you diagnosed with asthma? Do you remember?
Probably early on, probably like 5 or 6.
Okay.
It'd be early.
Did you take anything for it?
I would sometimes take an inhaler if it got bad, but no like daily medicine.
Okay. Do you still have a prescription for an inhaler or?
No.
Okay. In childhood, were you ever hospitalized for your asthma?
Uh,
Or emergency department visits?
yeah, I went to the emergency department a couple times for like asthma attacks.
Okay. Did you stay in the hospital or did you go home the same day?
No, I'd go home the same day.
Okay. And any intubation? No.
No.
Okay. And you also have bad allergies. Did you have any other major health problems as a child?
No.
Okay. Okay. So you did mention that you had surgeries,
Mm-hmm.
prior surgeries. So can you explain or tell me what those were for and when?
Sure. 2007, I tore my left ACL, and I had that repaired that summer 2007, with a cadaver ACL, and then I tore the same knee, same ACL in 2012. And then I decided to be smart to keep playing softball on the torn ACL, and then I tore my meniscus. And then when they did surgery for the ACL and the meniscus.
Sorry to hear that. And how does it feel now?
Pretty good.
Yeah?
I guess I still haven't learned my lesson.
Are you able to still do all the same physical activities you did before?
Yeah.
Or, okay. Do you use a brace or anything to help protect the area?
I do use a brace now.
Okay. Good. Very good. Have you had any other injuries? Any broken bones, accidents, or anything?
No.
Okay. Any other surgeries?
Nope. I had my tonsils removed.
Okay. When
I was really young.
5, 6?
Yeah, right around there.
Okay. So how about your immunizations? Are you up to date on all of them?
Probably not.
Okay. Do you know when you got your last tetanus shot?
No.
Okay. How about your tuberculosis, PPD? No?
Nope.
What about the flu shot? Do you get the flu shot every year?
Nope.
Okay. Did you get it this year?
Nope.
How about pneumonia vaccine?
Nope.
And hepatitis B?
Nope.
Okay. Do you think maybe you had gotten some of these as a child and just don't have the information, or?
Yeah, I might. I mean, I might have. I know I had a reaction to one of them, but
Okay. Do you remember what happened?
I would guess hives. That seems to be what happens when I have reactions to things.
Okay. Is there anywhere you can get this information from?
I could probably call my mom.
Okay. I encourage you to ask your mom for this information. It is important, and it's important that we get our vaccines and immunizations and the yearly flu shot. Is there any reason why you haven't gotten the flu shot or the pneumonia vaccine?
I'd say I'm just always busy running around. It just doesn't seem to happen.
Okay. I'm going to encourage you to get your yearly flu shot to protect yourself as well as the people around you. Let's see. Allergies. So you said you had a lot of allergies as a kid. How are your allergies now?
I mean, I would say borderline non-existent. I mean, the only thing is sometimes I'll have a little reaction to like a dog or a cat where I'd get like maybe a little itchy, but really just nothing, especially in comparison to what I used to have. So.
Okay. So the things that you were allergic to as a child, you don't get those signs and symptoms anymore?
No. Yeah,
Okay.
when I was a kid, I was basically allergic to literally everything. Like walk out, like the air.
Okay.
Yeah.
Are you allergic to any medications?
Penicillin.
Okay. What happened when you took penicillin?
Hives.
Hives.
Yeah.
How old were you?
Probably like 5, 6, somewhere around there. That seems to be when everything came to the surface.
When you got those hives, did you notice if anything happened to your airway? Did your chest feel tight? Did you have any difficulty breathing?
I have a pretty bad memory.
Okay. Would your mom know?
Probably.
Okay. How about latex? Are you allergic to latex?
No.
Okay. So your medications, you said you're on Propecia, correct? Do you know the dose?
1 milligram
Okay, and how frequently do you take that?
daily.
And you're pretty good about taking it every day?
Yeah.
Okay. Are you on any other medications?
No.
You mentioned
The foot thing.
Okay. Do you know what it's called?
No.
How frequently do you use that?
Once or twice a day.
Okay. Now, do you ingest it orally? Is it topical?
It's topical.
And you're pretty good about taking it, and you feel like it's going away, you said?
Yeah.
Okay. Do you use any over-the-counter medications like Tylenol or aspirin or
No.
Any supplements like vitamins, herbal,
Protein.
protein? What do you mean?
Like, for working out. Protein, I don't know if that supplement.
No, it is. So is it a shake? Is it
Yeah,
a bar?
yeah, like protein shakes.
Okay.
Sometimes a bar.
And how frequently?
Pretty much, like maybe once to twice a day.
Okay. Do you know how before or after workouts?
Both.
Okay. Okay, so let's move into your family history.
Okay.
There's a lot of genetic things that can affect our overall health or major illnesses, so it's always important to ask it now. So your parents, are they both alive and living?
Yes.
Okay. Any major health problems with your parents?
No. My dad has high blood pressure.
Okay.
My mom she's got a thyroid condition. I'm not sure which one.
Okay.
It's either over or under, but she's got one of them.
Okay. And you could probably find out if you just. So I would just encourage you to maybe learn a little bit more. It's always important to know for your health, your children's health. How about your brother?
He's pretty healthy. He's healthy now. He had viral encephalitis about like 6 or 7 years ago, which was weird. But other than that, very healthy.
Yeah. Do you have any other siblings?
No.
Okay. How about your dad's parents? Any major illnesses with them?
His dad, so my grandpa died right around 60 of prostate cancer.
Okay.
And my grandma is still alive. Pretty healthy. All things
Does she
considered.
have any diabetes, any heart conditions, any emotional disorders, anything? No?
No.
Okay. How about your dad's siblings? Any major health problems with them?
So one of them had seizure disorder, and so he died when he was about 20, kind of an accident around the seizures. And then he had two of the. My dad had 9 brothers and sisters in total, or 10. I forget what the number was. But the last 2 that were born had issues during their infancy, like SIDS, I think, and some kind of heart disorder, and they died within a year or 2 of birth.
Were they were twins, or they were?
No.
Oh, so they were birthed separately.
Mm-hmm.
Okay. And within the year, their first year, they had.
Yeah, first year or 2. I think one went in for an operation for the heart and died, and then the other one had SIDS.
And your father's sibling that died from a seizure accident, what happened?
They were on a boat. He had had seizures for a few years, but they were on a boat, and he had one, and no one was watching him. He went over the back and drowned.
Gosh, I'm sorry to hear.
Yeah.
Any cancers? Any heart problems? Any diabetes?
No.
Heart issues on your dad's side?
No.
No cancers or.
Well, the prostate cancer with my grandpa, but that's it.
Okay. And how about your mom? Her parents, are they still alive?
Both her parents are dead.
Okay.
One died of, the grandpa died of lung cancer. He smoked for a long time. And
do you know when he died? How old he was when he died?
I want to say between 70 and 80.
Okay. And what about her mom?
Her mom had polio, I know that, so she was in a wheelchair most of her life. I think she ultimately died of some type of cancer, roughly same age, 70s or 80s.
Okay. Does your mom have any siblings?
Yeah, she's got 3 brothers.
3 brothers.
Mm-hmm.
And any major health issues with
No.
her 3 brothers? Okay. And are your parents still together, or?
Yep.
Okay. Did anyone in your family have asthma? Like any of your parents or your brother or?
No.
Okay. So let's talk a little bit more about your kind of personal or social history. Who do you live with?
I live with my girlfriend.
Okay. Do you guys live in the city? What kind of house? Do you guys live in a home?
We live in an apartment in the city.
Okay. And do you feel that it's safe? Do you guys have smoke detectors, carbon monoxide
Mhm.
detectors.
Yeah, we get all the good stuff.
Okay, that's good. Do you feel like you're in a safe environment?
Yeah, definitely.
Okay. What do you do for a living?
Consultant.
Consultant? Okay.
Yeah.
Do you, working as a consultant, do you do a lot of heavy lifting?
No.
No heavy lifting. How about, are you exposed to any, maybe, chemicals or,
No chemicals.
okay. So do you feel overall the work environment is pretty safe?
Yeah, definitely.
So overall, would you say that, do you feel financially stable? Do you feel like you have access to health care? Do you have any concerns about it?
Yeah, no, I feel good. I've got the access to it if I were to try and get it. But I usually don't go to the doctor very often, but
Okay.
personal preference. But yeah, I feel stable financially, and I have the health care that I could want at my fingertips.
Okay, so any financial worries or anything?
Nope.
Okay. And your education level?
Graduate college. Have some professional degrees.
Okay. So at night, how many hours of sleep do you get?
I'd say not as many as I'd like. Probably like 6 to 7.
Okay, 6 to 7 hours.
Yeah.
Now, is this undisturbed sleep, or do you sleep throughout the night?
Oh yeah, no, I sleep like a rock.
Okay, that's good. Do you have a hard time falling asleep?
No.
No? Okay. And what about exercise or activities or hobbies? What kinds of...
I usually will lift weights or work out 4 to 6 times a week, I'd say, and
Okay. And how long are you working out for?
like an hour 15 minutes.
Okay. And then what is your workout like? What do you do?
I usually do mostly strength training, but I'll do like maybe 15 minutes of cardio.
Okay.
And stretching and stuff.
Good. That's good. What about, okay, so give me an example, like of a 24-hour diet. What have you eaten in the last 24 hours? And drink as well.
For dinner, I had some sushi yesterday.
Okay.
And this morning I had some eggs and some strawberries. And for lunch, I had like a quinoa chicken salad.
Okay. So do you mostly eat at home? Do you go out to eat a lot, or?
I'll usually eat out for lunch, but
Okay.
Breakfast and dinner at home.
Okay. And so when you're eating out
Mm-hmm.
at a restaurant, what kind of meal do you generally pick?
I mean, pretty healthy generally.
Okay, so
So it'd be like a quinoa thing. I get that a lot.
okay, so you
Or like
strive
chicken,
to
yeah.
eat healthy. Seems like it's important to you. Okay, that's good. So sounds like you're pretty busy. You're working out, working frequently. How's your stress level? How do you feel about your stress level and stress management?
Good. I mean, there's a little stress just with work and busyness, but very manageable.
Okay. Do you feel like you're coping well, or do you feel overwhelmed?
Yeah, I feel like I'm coping well.
Okay, that's good. In your workplace or at home, do you or anyone you know, are they being exposed to violence or abuse or anything like that?
No.
Okay, that's good. When you drive, do you wear a seatbelt?
Yep.
How about when you ride a bike, or do you ride a motorcycle?
No motorcycle for me. But
Okay.
yeah, I'll wear helmets and.
Okay, good. Is this important to you? Do you do it every time, all the time?
I mean, it's
Safety
important. It's important to my mom, so.
Okay, that's good.
Mm-hmm.
That's good. Let's see. Is there any guns in the house? I know it's a strange question, but we just like to know.
No.
Safe environment. Okay. And Do you feel like your home environment or your work environment, are you exposed to smoke or pollution frequently or?
No.
Okay, that's good. Do you have a religious affiliation? that you care
No.
to share? No? Okay. Okay. So now I'm just going to ask you a couple more personal questions, and I'm not asking because I'm nosy. I'm asking because I want an overall picture of your overall health, and this will better help me.
Okay.
Read, okay?
Alrighty.
So I just ask you to be honest, and I won't share this with anyone
Okay.
unless I have two caveats: if you're going to hurt yourself or if you're going to hurt someone else.
Okay.
Okay? Sound fair?
Mm-hmm.
So, do you drink alcohol?
Yes.
How frequently?
I'd say 2 to 3 times a week.
Okay. And so, how many drinks would you have in a night?
Not more than 1 or 2.
Okay. Do you smoke cigarettes?
No. My mom would kill me.
Sounds like your mom. Good mom. How about any illicit drugs, any illegal drugs?
Nope.
No. Have you ever done it in the past?
Nope.
In smoking cigarettes, have you ever smoked before?
Nope.
Okay. Good. Very good. And then your sexual history. Are you currently sexually active?
Yes.
Okay. 1 partner, 2 partners.
1 partner.
Okay.
Just my girlfriend.
Okay. So the one you live with?
Mm-hmm.
Okay. Are you using any protection or?
We use condoms.
Okay. All the time or once in a while?
No, all the time.
So are you concerned about any unplanned pregnancies or any
Yeah,
safety?
I'd say it's the pregnancy thing.
Okay.
No kids right now.
Okay. And in the past, how many sexual partners have you had in the past?
She's the only one.
Okay. Do you have a history of any sexually transmitted infections or diseases?
Nope.
Nope. Okay. So now I'm just going to ask you a couple questions about your overall physical health.
Okay.
Okay. So you said you feel good when I first asked you came in. Do you have any fever, chills, malaise?
No, temperature's pretty good.
Okay. Do you have any night sweats?
No.
Nope. Are you feeling any chest pain or tightness? Do you feel shortness of breath?
No.
Okay. Are you in any pain right now?
Nope.
So you said you went to a dermatologist about a month ago,
Mm-hmm.
and they didn't find any changes with your moles. How about your nails or anything like that? Everything's
Everything's good.
okay. Have you noticed anything different about your skin or your nails or anything?
Nope.
And you're pretty fair skinned.
You noticed.
Are you using sunscreen?
If I go in the sun, I do use sunscreen.
Okay, and how often are you applying it?
Probably not as often as I should. I'd say maybe every 5 hours, 4 or 5 hours.
Okay, and do you burn every time you go out in the sun? Or how?
No.
Do you burn frequently though?
I
Do
do
you feel
burn.
like you're
I
getting-
burn easily.
Okay. Do you
But I
feel
don't
like...
go in the sun that much, so.
Okay, well, that's good. You're protecting yourself. I'm just going to say that a lot of times people are using sunscreen, but they're not using it enough. And they think they're protected, but they're still getting burned. I would apply it every 2 to 3 hours.
Okay.
Or if you go into the water, or if you're sweating a lot and you feel like it's coming off, then reapply.
Okay.
Sound fair? Okay, how about your eyes? Do you wear any glasses?
No.
When was your last eye exam?
I don't know, whenever probably middle school or maybe driving, probably when I got my driver's license.
Okay, do you feel like you're having a difficult time seeing or reading? Okay. How about, do you have any hearing loss? Do you feel any ringing in the ear, any vertigo? No? Any problems with your ears?
Nope.
Okay. How about your nose? I mean, I know you had a lot of allergies as a kid, but you only feel it once in a while when you're around cats and dogs.
Yeah.
Do you get a lot of discharge from the nose or mucus?
No.
You have frequent colds? Or
No.
it's good? When was your last dental exam?
Like 2 weeks ago.
Okay. How'd they go?
Good. No cavities.
Oh, good.
Yep.
Did the dentist say anything else about your overall oral hygiene?
No.
Okay. So how often are you brushing?
2 times a day.
Good.
Morning and night.
Okay. And you floss?
Yeah.
Good. Do you feel any stiffness or soreness or any kind of tenderness, lumps in the neck?
Nope.
No? Feel good? Okay. Do you have a cough? Any?
No.
No. And you said no symptoms of asthma. You haven't felt that since middle school?
Yeah.
Okay.
No, nothing.
Do you have any heart murmurs or
Nope.
high cholesterol? Okay. Do you have any problems with diarrhea or constipation?
Nope.
Do you have any concerns about your bowel patterns?
Nope.
Any nausea or vomiting, abdominal pain?
Nope.
Do you have any food intolerances, like lactose intolerance or? Cool. How about, do you feel like you're waking up in the middle of the night to pee, or do you feel like you pee more than what you think is normal or what other people do? Frequency? No.
No.
Any painful urination?
No.
Any blood in your urine?
Mm-mm.
Okay. So I know that you got your surgery in your left leg. Your most recent one was 2012, and you said that you can still do all the physical activity. You wear your brace.
Yep.
But aside from that, is there any limitations in your other movement of your arms, your legs, or anything like that? No?
No.
Okay. Do you feel dizzy, numbness, tingling in your fingers,
Nope.
headaches? Do you have any problems with headaches?
No.
Okay. Now, do you have a history of sensitivity to hot or cold, or anemia, tendency to
No.
bleed a lot, like easy bruising or anything like that?
No.
No? Okay. And how about any emotional problems or illness have you had in the past, or
No.
no? Any anxiety, depression?
No.
Okay, good. Well, I know I asked you a bunch of questions, but it really does give me a better idea of your overall health. Is there anything else you'd like to share or anything that I missed that you would like to tell me at this point?
No, not that I can think of.
Okay, let's move on to your physical exam.
Okay.